Well, you can add another positive side effect of the Mediterranean diet to your list.
All right, so new research says not only can this diet help with PTSD, but could actually prevent its symptoms that we see happen to a lot of people often. So our 9 News medical expert, Dr. Kohli, joining us this morning to explain what this study is and what it said.
Yeah, very fascinating. So we know a lot of people are exposed to trauma, right? But not everybody goes on to develop PTSD or post-traumatic stress disorder. So the diet, it seems, may be the missing link. And what they did is they actually followed tens of thousands of women over several years. They looked at their stool samples, they looked at what they were eating, and then they looked at whether or not they developed symptoms of PTSD. And as you said, the ones that followed a Mediterranean diet rich in fruits and vegetables, nuts and legumes and olive oil actually had fewer PTSD symptoms. And then if you break it down further, you saw that plant-based foods were associated with fewer symptoms than red meat or processed meat. So really fascinating.
Wow. Well, I mean, we've long known the Mediterranean diet is one of, if not the best diets out there, and now on top of it could help with PTSD. I mean, that's a huge finding.
This is huge. And as you said, cancer, heart disease, all different types of things, but the connection between the gut and our mental health is really what this study adds, which we don't realize what we eat can influence how we feel, and the scientific mechanisms are very complicated.
100%. We say that about depression, we say it about anxiety too. We say, well, what are you eating? And that sounds like a weird question, but you're exactly right. It's directly connected. What are some possible explanations as for why these are connected?
Yeah, so the gut-brain connection seems to be very, very complex. So hormones are a big part of it. So what we eat can trigger sort of the hormones that our gut releases, which then make their way up to the brain and influence how we feel. The microbiome of the gut, which is the bacterial colonization that lives in our gut, that's why we see probiotics can sometimes have a positive effect on PTSD, can actually influence the fear centers in our brain, the amygdala, which modulates our fear. And then inflammation seems to be the last piece of that. So when we eat red meat or processed meat, it makes our gut more leaky. So more of the bacteria from the gut actually gets inside the bloodstream, causing systemic inflammation, which then makes its way up to the brain and can cause effects.
It never sounds good when anything is leaky. Like, you don't want that, right?
Well, it's so interesting because we just recently did another one of these segments where the organs are talking to each other, and it just shows you that everything is kind of linked. Here we're talking about the gut and mental health. It's kind of like you have to take care of overall health because they're all talking to each other.
Very much so, and I think this has a lot of implications for how we think about treating or preventing PTSD for anyone that might be exposed to any sort of traumatic events, because the organs are 100% talking to each other, and what you do in one influences the other, and it's bidirectional. So, you know, obviously an exposure to a traumatic event can affect our gut, affect how we feel, affect how we digest, but it's the other way around as well. So we think about our vets, we think about people that are exposed to these types of events regularly.
Right.
We may want to start putting them on a prescription for a Mediterranean diet. And, you know, as a cardiologist, I do this all the time anyways. It's the most commonly prescribed diet that I tell my patients about, because we know there is a causality with heart disease reduction, with cancer reduction, lots of benefits.
Yeah, absolutely. I mean, I was just thinking about that too. And you know, when it comes to PTSD specifically, there are so many things that are outside of your control.
Very.
Why not control what goes into your body if that's going to help? At least remove that factor from it.
Absolutely, but I think this opens the door for more research, because this study was only in women, so we want to make sure that this effect applies to men as well. And then, of course, this is an observational study, which means we were observing what happened, so there could be other things. In other words, the people that ate the Mediterranean diet could also be exercising more, could also be sleeping better, so we want to really try to pick that apart.
But maybe that's because it's affecting your mental health positively and you want to do all those things, right?
We got to pinpoint things, though, and a little bit more on this study.
We're going to get one of those boards with the yarn and everything out and, figure it out.
Dr. Kohli, as always, thank you so much for coming in.
Let's get